The Michigan Bariatric Surgery Collaborative is a physician-led quality improvement program comprised of hospitals and surgeons. Since our launch in 2006, the MBSC has grown to include nearly all hospitals that perform bariatric surgery in Michigan, reflecting the wide diversity of populations and practice settings in our state. Funded by Blue Cross Blue Shield of Michigan and Blue Care Network, the collaborative is focused on enhancing the care for bariatric surgery patients throughout the state and has become a national leader in surgical quality improvement. To reach the highest levels of bariatric surgical treatment, we are working to improve overall patient care, surgical practices, and the surgical experience. In order to continuously improve patient care, participating centers submit data to a central clinical registry. We then meet throughout the year to analyze our data and identify areas for improvement. Together, we design and implement strategies to achieve our improvement goals. And finally, through a process of continuous assessment and evaluation, we're able to refine those strategies to ensure the highest level of care for all of our patients. In order to innovate surgical practices and enhance the technical skills of our practitioners, surgeons coach each other by analyzing surgical videos. Our surgeons use videos to identify the safest and most effective techniques for performing bariatric procedures. Finally, to enhance the surgical experience, we have developed unique tools to help patients understand if bariatric surgery is right for them, and to help guide them to the operation best suited to their needs. By focusing on patient-reported outcomes, we're learning what matters most to our patients, facilitating communication between patients and their doctors, and delivering patient-centered care. By working together, we have increased safety for patients having bariatric surgery in Michigan. Through our collective efforts, we have lowered the risk for wound infections and potentially life-threatening blood clots, reduced the use of unnecessary procedures, and dropped the rate of readmissions to the hospital following surgery. In this unique collaborative environment, we are learning from each other and striving toward a common goal, making Michigan the safest and best place in the country for bariatric surgery. For more information, visit www.michiganbsc.org or call 734-998-7481.